Welcome to Shooting Straight with Brad and David. I'm Brad Carline, your Navajo County attorney, and Sheriff Klaus couldn't be with us, so he sent his chief deputy,
Brian Swanty.
And our guest this month is Jannelle Lynn, the head nurse with the Navajo County Public Health Department. Did I get all that right?
You got it right.
So what exactly is a public health department?
So a public health department is a government-funded organization that looks out for the health and safety, welfare benefits of the community.
That sounds like a fancy description, but in practical sense, what do you guys do on a day-to-day basis?
So there's multiple programs under public health. I'm over the nursing services programs. So we are over things like immunizations, family planning, which is well woman health care for women who don't have insurance, so they don't fall between the cracks with their well woman care. We do the infectious disease monitoring, tuberculosis monitoring. We do a child fatality review where we review the deaths of all the children who die in the county to determine the level of preventability so we can come up with intervention strategies. We have, trying to think of all our programs, perinatal hepatitis B program. We have a lot of different programs under nursing. Infectious disease is probably our largest one.
So you have a lot on your plate on any given day. So I take it you're a nurse.
I am.
How did you get from what most people think nurses do into the public health side?
So I used to work labor and delivery and pediatrics, and I got tired of working nights and weekends and holidays and being away from my kids. So I decided to give public health a try, and I love public health. So I've been a public health nurse for 19 years. I worked all of that with Navajo County, and I worked for 9 years as a regular public health nurse, and then for the last 10 years I have been the nursing supervisor.
So how many nurses are in the health department?
There's myself and one other full-time nurse, and then we have two 30-hour-a-week nurses, and then we have some part-time nurses. We have 3 part-time nurses.
And what are the things that you do? Because it sounds like there's a lot of people who aren't nurses, but so what kind of services do you provide people in the public?
So I'm administrative, so I manage most of our medical grants and supervise about 10 people, and I'm over the division that's for clinical services. But and sometimes I see patients. The other nurses do everything from infectious disease monitoring. So there are certain lists of diseases that are required by state law to be reported, and we do some surveillance on that. And it's mainly because they're diseases that are highly infectious and can easily spread throughout the community. So we want to get a handle on that as soon as we can. So we call the people, determine where they may have been exposed, determine who they may have exposed. Do we need to intervene with some medications to stop this? Do we need to ask you to isolate in your house? That's kind of what's going on right now. Some things like that. But we also have patient services where women come in and get pap smears and their contraceptives and come in and get vaccines, or these aren't real popular, but HIV and STD testing and treatment and things like that as well.
So go ahead.
Where do you get your information from? Is it from the hospitals pass along? You know, we've had an outbreak in this type of disease or whatever. Is that where you get your information?
A couple of different routes. So the providers and hospitals are required by law to report it, so they report it to us. There's also laboratories electronically report, so sometimes it gets reported to us that way, and sometimes it's concerned citizens who pick up the phone and say, I heard my neighbor had this, what do we do?
So COVID-19 is the big infectious disease at the moment.
It is.
But it sounds like there's lots of others that you watch out for.
Right.
What are some of the other ones that may pop up on your radar occasionally?
Tuberculosis is one we watch very carefully because it is easily spread. All you have to do is share airspace with someone. Syphilis is a big one that we have a problem with and that we monitor very closely in our community. Hepatitis, foodborne illnesses like E. coli, salmonella, those are some of the ones on the reportable list.
So then working with these other infectious diseases, did that give you a good practice for what came up with the COVID-19?
It did. So we go to trainings and meetings on infectious disease often. One of our nurses, our other full-time nurse, her name's Kathy Solomon, and she is our infectious disease nurse, and that's pretty much her full-time job. She does anywhere from, I would say, 1,700 to 2,400 infectious disease investigations every month.
Every month?
Every month.
Wow.
Not during COVID time.
Wow.
And so she's very busy. And then sometimes I'm the one who backs her up and acts as her backup.
So what were the main
Winchester.
infectious diseases that she was looking at every month to get to those type of numbers?
During flu season, it's flu
Okay.
and RSV cases, a lot of them, and our heaviest months are usually during flu season. But there's a lot of hepatitis A here, a lot of Giardia, some salmonella. There's a lot of different ones.
So there's the talk that the symptoms of flu and COVID-19 are similar.
They are.
Does that cause confusion for you guys?
It does. It does cause confusion. Typically with seasonal influenza, you do not get stomach issues, and that's different from COVID, but not everybody is getting nausea, vomiting, diarrhea. But that's one way we've been able to differentiate, but it has been confusing. There are tests for both. So what we're doing is suggesting people go to their provider, because we at the health department don't provide the testing. That's through the provider, we're the surveillance piece. And so if you test negative for a flu test, we become even more concerned that perhaps it's a COVID situation.
So what is the Navajo County Public Health Department role in all of this COVID-19, and how do you interplay with the State Department of Health and the National Institute for Health and the Center for Disease Control and all those other acronyms out there?
So the National Institute of Health is typically research focused, and so they've been really interesting to watch now because there's so much that's unknown about COVID, and so we frequent their site to see if there's any new studies coming out or information there. Then the CDC is under an organization called HRSA, which is the Health and Human Services, and they fund the Center for Disease Control, which is very specific to particularly our infectious disease program. And so they come out with the national recommendations, and then our state health departments communicate with them. Sometimes they align their recommendations with the CDC. Sometimes they differ a little if your situation is a little bit different than other places in the nation. And then we work with the state health departments to carry out that work. So we're the ones, the boots on the ground, doing the surveillance, contacting people, like I said, to determine where could they have possibly been infected, who could they have possibly exposed, and how do we stop this spread of infection as soon as possible. And then we have responsibility for that in our jurisdiction, which is Navajo County. And then we report that data to the state, and then they compile it and go from there.
So if I were to get the COVID-19, somebody from the health department would come visit me?
Yeah, so if we got a test result that you were positive, we wouldn't come visit you, we would call you because we're
Okay.
trying to do our social distancing, and we would talk to you. We'd talk to you about your symptoms. We would ask you, who lives in your household? Is anybody else symptomatic? Because we look at that in kind of tiers, and if someone is a confirmed positive, we're most concerned about their household. They're most likely to have infected other members of their household. Then we may look at their work environment and their social circles and things like that. And then we start contacting people out from there. So some of our positive cases have had contacts up over 50.
Oh, wow.
So how far out in this circle do you go? So once again, say I had it, do you contact everybody in my office? Do you contact people that I may have run across in different stores or different things?
So when we talk to you, we'll have a really in-depth conversation. Some people are like, whoa, you're like getting really personal. So we want to know, where have you been? Well, what did the nature of your contact look like? How close were you? Does this person just work in your building and they work, clear down the hall and you didn't have any contact with them? Or do you share a cubicle and you're right close to each other all day long? We look at the nature of the contact, how long their contact was with that person. were they wearing a mask? What was the hygiene situation? Did you shake hands? Different things like that, the whole nature of the interaction and the contact. And then we go from there. And so it's very individualized, case by case and person by person. And then the individuals that they had contact with, we classify each one of those. This is a low to no risk contact. This would be a moderate risk contact. This would be a high risk contact. And we focus on the high risk contacts first and then work our way down from there.
And so that scenario that you just laid out there, that's done just with your staff.
Yes.
And that staff was, remind me again, was it 5?
So right now there's 2 full-time, 2 part-time, and 3 as needed hourly nurses.
Wow. So needless to say,
We've been working 80-hour work weeks for the
wow.
last about 3 months. But they are awesome ladies. They really are.
So you interviewed me and you found out that Brian had been in close contact with me. How do you find out how to contact Brian?
I ask you, do you
Okay.
have Brian's number? If not, then we start getting creative. Well, do you know where I could find his number? Or I happen to know you're both county employees. I might call the HR department and say, hey, I need Brian's number. And a lot of the HR departments have great. They know we just can't ask a lot of questions, and they've been giving it to us. Mm-hmm. And we get a hold of them one way or another, and then we find out. We make sure his description of your interaction matches what you told us, because sometimes you may forget something and he's like, oh no, he didn't tell you, like we shook hands, and or we shared a soda, or something like that. I hope you're not doing that, but some household members do. And so they sometimes give you clues that the first person left out. Then we find out if he's symptomatic. And if you're symptomatic, then we've got to trace out the people that you had contact with as well.
So it can
chain
just
reaction.
snowball.
Yes. Yeah.
Let's say he's not symptomatic. Do you give him any warnings? Suggest self-quarantine? What are you communicating to somebody like Brian?
So it depends.
Okay.
He's in law enforcement, so he would be on the government's list of critical workers.
But also high risk, because he's in a reaction with a lot of people.
I'm glad you were saying that, and not because I was old.
I think I got you beat at the age part.
So what we would do if he was symptomatic, we would ask him and his whole household to isolate for at least 10 days from the date of his last interaction with you, if you were our confirmed case. And he would have to be symptom-free for at least 72 hours. So whichever of those situations was longer is how long Brian and his household would isolate. If you're not a critical worker, you have to isolate for 14 days from that exposure and be symptom-free. So, however, if he didn't have symptoms, we would let him be at work, but he would have to be monitoring himself very closely every day. And if he developed the slightest of symptoms, he would have to isolate, and he would have to be wearing a mask and taking some very intense precautionary measures to be at work.
Who is defining who this essential worker is?
So there's the government, federal and state, have lists of essential and critical workers based on your type of employment. And then we also sometimes call the organization and be like, Brian says he's essential to the day-to-day operations of your organization. As his supervisor, do you feel the same way? And some of them say, yeah, I can't operate without him, but I will make these accommodations so he can work from home, or we will make sure he's in an office all by himself. And others be like, oh no, we can get along just fine without Brian. Keep him as long as you need to.
Should I ask David?
Yes, you probably should have saved that one for the sheriff, for sure.
So you're talking to people all day long.
We do, yeah. Some people think we're starting to get sick because we get a little hoarse because we just are like talking to people all day long. But
as hopefully this will start winding down someday, hopefully soon, how will your function and the function of the health department be changing at that time as it's dealing with this, or will it?
It will. We will ramp down and go into a recovery plan and return to normal day-to-day business. However, like I said, infectious disease is a huge piece of what we do all the time anyway. And we're constantly we've been preparing for a pandemic since I started here 19 years ago. And so we have very specific plans in place, outbreak response plans, and we review those regularly. We work with the emergency management and public health emergency preparedness programs in the county, and we're constantly reviewing our protocols. We have practice mock events for various types of public health emergencies and natural disasters, so that when things do happen, we know we're prepared and we all know what to do.
So did it fall into place, your practice, your role play things with what actually took place with the COVID-19?
We have done pandemic flu outbreaks, so they have helped us to prepare for this, yeah.
So it was a seamless transition when it actually
Well, I
occurred.
wouldn't say totally seamless. It's been a real learning curve, but yeah, it was much easier because we felt much more prepared.
So as you go into the next planning stage after all this has come to pass, what new thoughts will you bring into that planning stage?
So when an emergency is over, whether it's a health emergency or a natural disaster, then we get together and we do what's called an after action plan. And every person who was part of that response provides feedback on the things that they thought went well and the things that they think need improvement. And then we meet as a group and we really just spend a lot of time discussing that and how do we need to adjust our plan to be better prepared the next time.
So I assume you'll do that on the Navajo County Health Department level. Will
Right.
somebody from the health department be doing that on a statewide level?
The state usually does one as well and asks for input from the different county partners. So usually every organization that's involved does their own, and then we share the information with each other.
So you're keeping notes on what to share when that comes up?
We are.
You also talked about being involved with the emergency management component. What is the health department's role with emergency management?
So emergency management and our department are actually combined. Jeff Lee is the director of both emergency management and of public health. And so we work very closely together on a day-to-day basis anyway. And everything from planning and response to sometimes we call and be like, okay, we have an E. coli outbreak here. Can we get your assistance? And they do the same. When they have a fire or a natural disaster, they involve us in the process as well.
And even while COVID-19 is going on, you have all your other functions to keep up with and other infectious diseases that are still being spread around.
And this is really unique in that we have to do those, but we also have to take really special precautionary measures to make sure we don't infect our patients. So we have to screen our patients. We've really had to space appointments out. We're doing some things, you may come by and get your refill of your contraceptive in the parking lot. You may get your shot through the door of your car. We're meeting people in the parking lot, and if we have to bring them inside, they have to be screened very thoroughly, wear a mask, and we have to really space it out, make sure we're thoroughly sanitizing the whole clinic between each patient.
So what are you doing to screen the public as they come into your building?
So we're asking them a list of questions, basically determining if they've had any symptoms. We ask them if they have traveled. We ask them if they've had exposure to a known contact or someone else who's had these types of symptoms in the last 14 days. We take their temperature. If they pass all of that, then we ask them to mask up and come on in.
Why do you ask about the travel?
Because the travel was more important in the beginning, especially if they'd had foreign travel to countries that were infected before the United States. As the disease process has spread out, it's not as pertinent as it was in the beginning. But there's still hot spots throughout the nation and throughout the state that it'd be pretty, if they've been to New York in the last 14 days, we may not have them come in the clinic just to be on the safe side.
Understandable. So, as part of the public, what should they be looking for if they have concerns that they might be getting the COVID-19? Because you just said that there's a list of questions and symptoms that you ask. What should people be asking themselves if they have it?
So there's a broad range of symptoms with COVID, which is really interesting. Some people are having stomach problems, nausea, vomiting, diarrhea. The most common complaint that we're seeing with the different cases is fatigue. And it's described to us as a fatigue like they have never experienced, like they just can't get going and it lasts and lasts and lasts. So that's a really common one. Fever, but not everybody's having a fever. And a lot of the ones that are having a fever, it's a very low grade fever. Headache is another common complaint that we're getting. A lot of congestion, stuffiness, some tightness in the chest and shortness of the breath. A lot of people are saying it's like I went and hiked Baldy and you just kind of can't catch your breath type of a feeling. And then we're getting people saying things like their eyes hurt, not like itchy allergy eyes, but just like really throbbing pain in their eyes, body aches, chills. It's a very broad range of spectrum.
And there's not one common set.
No, everybody's is a little different, and the severity is very different.
And then some are asymptomatic and don't have any symptoms.
Yes, we've had a couple test positive that just happened to get tested that came up positive and were totally symptom-free.
And what would be how would that be? Is it just have a good immune system at that point in time, or what? How do you explain that?
It can be the people who seem to be succumbing to the illness or having more negative outcomes tend to be having a lot of underlying health issues, so heart disease or diabetes or an immune system disorder, but not always. And so it's just very individualized, and there's very few commonalities. That's partly what's made this so confusing for everybody.
Interesting.
When people get tested, you're not testing them, but is the information, results of those tests being reported to your department?
Yes. And we have really good relationships with our health care partners across the county. So I would say I speak with Summit's infection preventionist probably 2 or 3 times a day. Little Colorado's at least once a day, sometimes 2 or 3 times a day. We're speaking to Dr. Close down at White River. We have really good relationships with all of our various healthcare partners, and we all have each other's cell phone numbers, and it's not uncommon at 2 in the morning to be like, hey, we just had somebody come in. I know it's going to be positive, or hey, we just had a lab result. We literally talk at any given time. They call as the results come in usually.
And then do you report that to the state, or are they reporting both to you and to the state?
So they report to us, and then there's a shared electronic system that the state uses for every county in the state. And there's a set of questions in there that we ask each case, and add certain information on all the confirmed and probable cases. And then we send that information back to the state.
So you're getting basic demographics like age, gender. Do you get information on underlying health issues?
We do. We ask their underlying health issues. We detail out their symptoms so that they can, sometimes you'll notice they adjust the symptoms list and they'll throw a new symptom on. It's because of things like that. We're seeing a lot of people that are reporting this particular symptom that may be new. So for example, one of the things that's come through this process is they're starting to see some people having clotting issues, strokes, little petechial hemorrhages in their hands and feet after this. So that's one of the symptoms they're watching now. Do we need to add this to the symptom list?
So even after the fevers and other symptoms pass, there's still apparently now a new risk time period.
Right. It'll be really interesting to me when this is over to see what the long-term effects of this illness are.
In what sense?
For me, clotting issues is really interesting. They're having some people in their 30s and 40s who fully recovered, and then they're coming into the ER having a massive stroke. And then I'm wondering about the ones who are pretty significantly ill, the long-term respiratory effects, if there will or won't be problems for those individuals.
Because the COVID goes into the lungs. That's why you're worried about the respiratory impact.
Yes. A lot of the people that are dying from COVID are dying from pneumonia. It causes a really severe pneumonia.
Anything else you want to share with our audience about COVID-19 and what's going on right now?
We're just encouraging people, don't panic. Just be smart. Get information from credible sources. Wash your hands. You know, you don't need to panic, but watch your social interactions with people. Consider if wearing a mask is something that's beneficial to you or not, because there's mixed information about that. Monitor your symptoms. If you feel like you're sick, stay home. It's not worth risking it. Stay away from people in your family or your community that you know are high risk. The elderly or people with underlying health conditions. Just try to, stay away from them, period. And then just be smart. Try to avoid large congregational public events and, go out when you have to go out, but don't panic.
Well, Jannelle, thank you for joining us. Usually we'd
Thank
shake
you.
hands, but
Yeah,
we'll pass this
today,
time.
sorry.
No, thank you.
Thank you.
And thank you for joining us this month. And now, stay tuned for this month's Most Wanted.
The Navajo County Sheriff's Office is seeking Jeffrey Kilcoyne, a white male, 32 years old, with brown hair and brown eyes, 5'10" and 170 pounds. Jeff is wanted for failure to appear with original charge of assault. If you have any information of the whereabouts of Jeffrey Kilcoyne, please contact the Navajo County Sheriff's Office at 928-524-4050 or anonymously contact WeTip at 1-800-78-CRIME or at wetip.com.